Canine parvovirus is a highly contagious virus that can affect all dogs, but unvaccinated dogs and puppies younger than 4 months old are the most at risk. Dogs that are ill from canine parvovirus infection are often said to have parvo. The virus affects dogs' gastrointestinal tracts and is spread by direct dog-to-dog contact and contact with contaminated feces, stool, environments, or people. The virus can also contaminate kennel surfaces, food and water bowls, collars and leashes, and the hands and clothing of people who handle infected dogs. It is resistant to heat, cold, humidity, and drying, and can survive in the environment for longer periods of time. Even trace amounts of feces from an uninfected dog may harbor the virus and infect other dogs that come into the infected environment. The virus is readily transmitted from place to place on the hair or feet of dogs or via contaminated cages, shoes, or other objects. Some of the signs of parvovirus include lethargy, loss of appetite, abdominal pain and bloating, fever or low body temperature, vomiting, and severe, often bloody diarrhea. Persistent vomiting and diarrhea can cause rapid dehydration and damage to the intestines, and immune system can cause septic shock. If your puppy or dog shows any of these signs, you should contact your veterinarian immediately. Most deaths of parvovirus occur within 48 to 72 hours following the onset of clinical signs. Diagnosis and treatment of parvovirus infection is often suspected based on the dog's history, physical examination, and laboratory tests. Fecal testing can confirm the diagnosis. No specific drug is available that will kill the virus in infected dogs, and treatment is intended to support the dog's body system until the dog's immune system can fight off the viral infection. Treatment should be started immediately, consists primarily of intensive care effort to combat dehydration by replacing electrolytes, protein, and fluid losses, controlling vomiting and diarrhea, and preventing secondary infections. Sick dogs should be kept warm and receive good nursing care. When a dog develops parvo, treatment can be very expensive, and the dog may die despite of aggressive treatment. Early recognition and aggressive treatment are very important in successful outcomes. With proper treatment, survival rates can approach 90%. Since parvovirus is highly contagious, isolation of infected dogs is necessary to minimize the spread of infection. Proper cleaning and disinfection of contaminated kennels and other areas where infected dogs are or have been housed is essential to control the spread of parvovirus. The virus is not easily killed, so consult your veterinarian for specific guidance on cleaning and specific disinfecting agents. Vaccination and good hygiene are critical components of prevention. Young puppies are very susceptible to infection, particularly the natural immunity provided by their mother's milk may wear off before the puppy's own immune system are mature enough to fight the infection.